Welcome to The Solution Behind the Symptoms, a show where expert therapists and doctors help real-life patients heal from chronic symptoms. My name is John Gasenica. I'm a therapist, a researcher, and I'm very proud to be hosting this show in partnership with the Association for the Treatment of Neuroplastic Symptoms. Today you'll hear from an absolute legend, Dr. Howard Schubiner, one of the leading voices in understanding how the brain can create and reverse chronic symptoms. Then we'll take you into a therapy session with a medical student who pushed herself very hard to get through school, but when her responsibilities finally eased up, her symptoms got worse. You'll see how combining some of the most cutting-edge tools can reverse chronic symptoms, often faster than people expect. So let's get into it. All right, so joining me today is Dr. Howard Schubiner. For decades, Dr. Schubiner has challenged the traditional understanding of chronic pain. As a physician and researcher, he's shown that symptoms can be driven by the brain, and more importantly, that they can be reversed. He's the author of the soon-to-be-released book, Unlearn Your Pain, and a leader in developing emotional awareness and expression therapy as well as PRT. Top of all of that, he's been an incredible mentor to me and a consistent source of information, and probably has one of the smoothest golf swings in all of the field of neuroplastic medicine. Howard, it's so good to see you.
One of the shorter hitters in the field of neuroplastic medicine, unlike the famous John Gasenica, but thank you so much, John. It's a joy. It's a joy to be here with you on this incredible service you're doing to the community. So I'm grateful to you.
I appreciate that. Well, we were talking a little bit before, but I pressed record about your book. I'm just absolutely thrilled for it to come out. I tend to read all the stuff that comes out in this field, and I've been waiting for something that they can start teaching in graduate schools and undergraduate programs the same way they give The Body Keeps the Score to people. It's so fantastic. It's broken down into 3 parts for the listener. First part is just Howard explaining this process, how the brain can create these sensations. The second, he's dispelling all of these misnomers about different types of diagnoses that you can be given and how they can be harmful. And then finally, he gives you all the solutions on how to fix this issue. It makes me think of when you started in this field, there was CBT for chronic pain, mindfulness-based stress reduction. But when you look at the meta-analyses for these modalities, they didn't do much for pain. They might have decreased anxiety, but pain maybe moved like a half a point on the 1 to 10 scale. What changed in the last 10 to 15 years? Why are we able to get such better results now with therapies for pain?
Boy, I've thought about that long and hard. When you look closely at the therapies, ACT, CBT, and mindfulness, they're designed to help people cope with pain, manage pain. They're not really designed to reverse pain, because when they developed, the idea in the field of chronic pain was once you have chronic pain, by definition, it's chronic. By definition, it's irreversible. And so the goal, and Mark Lumley and I have been round and around on this with leaders in CBT around the country and the world. And they're like, why are you even measuring how much pain there is? Because we're not designed to reduce pain. You should be measuring pain interference, because we're designed to reduce interference with pain. In other words, coping better with it. So, that's pretty basic difference. The other thing is that when you go into a standard psychological therapy, there's no kind of assessment of the problem. There's no medical assessment. And that's what was done in the Boulder back pain study, in the puppy trial soon to be released, in the trial you guys are doing now. There's an assessment, and people are given information and exploring, well, is the pain neuroplastic or not? Or is it a combination? And I'm so proud to be part of this movement where we now have research showing that in people with chronic back and neck pain, the vast majority of them are actually neuroplastic. We're talking like 80, 95%, which is the same number that you see neuroplastic in irritable bowel syndrome or chronic abdominal pain, chronic headache pain, chronic pelvic pain, etc. So the second thing is making that assessment and communicating that in the terms of neuroplasticity about reversibility to clients. And then the third thing is dealing with emotional underpinnings and looking at the actual underlying causes of what we see in most folks. Those 3 things, I think, have made a huge difference.
In your book, you connect chronic pain, anxiety, fatigue, POTS, MCAS, Ehlers-Danlos, kind of under this similar driver of all these symptoms. What is that similar driver that you're tying these things together with?
Yeah. I spent a lot of time working on that. The book has over 800 medical references to really look at each one individually and not just kind of have some kind of blanket assumption, to look at each one individually and look at the medical data for why these conditions, by and large, and each person needs an individual evaluation to make sure we haven't missed some structural problem. But when you look at it carefully, as we've done in our experiences, that all of these conditions are tied by increasing in society in the last couple decades, striking younger people, teens, 30s, 40s, occurring without clearly identifiable structural problems, being connected to all the other syndromes. If you have one, you're more likely to have another one of these likely neuroplastic conditions, and being connected to childhood trauma and underlying emotional distress. So you put all that together, they have so much in common with each other that it's just, and what we see clinically is people respond to the same interventions that we're talking about here, to all those things.
Well, the first two parts of your book are fantastic. It's just in terms of information and setting people's minds at ease, almost decreasing uncertainty. And then the third part of your book is all these methods of how to just increase your tolerance of uncertainty. And so that's what I'm really excited about showing you today. Is I found a patient that I did a session with who has so many elements of all the different things you talk about in your book of how to overcome pain. Because one of the best things I've learned from you is that it's often not one thing that's going to move the needle for somebody. It's this holistic approach. And so why don't we get into this session with this patient so we can hear how she does?
Well, I'm when you think about it, I've been doing this for decades, so I'm the old guy, but I consider you a master in doing this work. So I'm excited to see that and to see you in action.
I appreciate that. Well, let's get to it. So, Luca, can you tell me a little bit about what you've been going through, what you've been experiencing?
So my pain started about a year ago, maybe a little bit more. And it started in my shoulder area. So I had a lot of pain in my clavicle, in my shoulder itself, on the right side, and in my neck also. And it started with what I thought was a bit of too much yoga practice. I had just finished my medicine studies, so I was just enjoying a bit of time off after my final exams. And so I did a lot of yoga, and maybe a bit too much, I thought back then. And so I started developing this pain, and so I stopped for a bit, but it never went away. And until now, I feel it.
This happens quite a lot when people go through like a very stressful period and then things get very quiet.
Mm-hmm.
And the brain's almost not used to that quiet. It's kind of on the lookout for danger and lookout for something to do. In the headache community, they call this the weekend headache.
Oh, wow.
And so for you, it seems like when things quieted down and there wasn't medical school to worry about, your brain reacted in a certain way.
Yeah, that makes a lot of sense.
Can you remember that period of your life? Did it feel easy to just relax, or did it feel difficult coming off of studying to do that?
Oh, I felt so comfortable in that structure where I was just forced to surrender to this studying, to this pressure. I had this set point, just fixated. I was just fixating on it. When the last exam was finished, it felt like this kind of void that I had not even thought about it. Like I kept working and kept studying, and afterwards I had not even anticipated what was going to happen next. I think I tried to fill that void also with a lot of yoga because it was sort of my happy place also during studying. But you described it quite accurately actually, because it was just my mind had no place to go.
This often happens when the brain associates value with productivity.
Mm-hmm.
It can come from childhoods where you're kind of taking care of somebody else or somebody else's issues take precedence. Can you think of how in your history your brain has become convinced that you need to kind of stay busy, you need to be valuable to kind of justify your existence?
Yeah, absolutely. I mean, even just starting medical school was sort of my, I'm going to say flight into, it was just an option for me to stay busy and to get away from I I studied abroad. So I moved country. I went to Germany, studied medicine there. And it just meant that I could just have this, I'm not going to say excuse because it's a bit too much for it to be an excuse, but I just had this project that I could just, pour myself into and always have this, as a reason to say, I'm doing something, I'm being productive. I have this, I can show other people, and especially people that I feel that have certain expectations of me, that I fulfill certain standard or expectation.
How often do we see that, huh?
Yeah, I was going to ask you, what's your initial reaction of this patient?
Yeah, it sounds like me. I was thinking about it as like if you think about the brain as being able to speak to us, or if it could speak, what would it be saying? And it's saying, good, keep working, you're working hard, you're doing good, you're of value. And then it's also like, but you know what? You're also working too hard. You're really stressed. It's finals time. And then you relax after finals and it's over. And the brain's like, okay, I let you through finals. I didn't cause any pain during finals, but you know what? Don't do that again. What are you doing? What are you doing? So I think, kind of on the two levels, that on one level, it's you feel valued. I mean, when people ask me, geez, why do you do this work? The first thing that comes in my mind is like, well, I'm just trying to make my mom and dad proud of me.
Totally.
Why do you work so hard? But I mean, she's so sweet and so obviously, caring and tries so hard, needs to be good, needs to be of value. And it produces so many positive things. She's going to be a hell of a doctor, but, there may be a cost if she neglects her own needs.
And can you just kind of spell that out? Why is there a cost for having this personality type? Why do we have to get punished, or why do we have to suffer for being caring and thinking about others and wanting to do well?
Yeah, because when we're actually neglecting our own needs, when it gets to the point, and it's really about balance, but when it gets to the point where we're neglecting our own needs. When I was in my 30s or 40s, I started getting neck pain. And I was at a point in my career, I was a young doctor trying to prove myself, trying to be the best researcher I could be, the best clinician I could be, the best teacher, the best program administrator at work in an academic setting to try to get promoted. Meanwhile, I have small kids, I have a family, I have a wife, I want to be a son and a sibling and a husband. It's so much pressure on myself to excel in all those things that at some point the brain is feeling like, okay, the danger signal comes on and it's like a smoke alarm, there's just too much. And so, it's not that people shouldn't be caring and giving and do for others. It's just that if they never do for themselves, your brain is going to react to that at some point sooner or later.
So this patient has pain in her clavicle or arm. When she kind of moves her arm around or puts it above her head, it's painful. And one of the reasons I wanted to bring this session to you is it's a great patient to do what you call provocative testing with, and we'll hear it in the next clips. Can you introduce that a little bit, or just tell people what that means?
Sure. It's just so interesting if you really understand neuroscience and how the brain works, that the brain predicts what it's going to do moment by moment. And its prediction is usually based on what it did last time. So every time you raise your arm, you're getting pain. That's been going on for a while. Every time you're going to raise your arm, your brain is producing pain. Every time you think about raising your arm, your brain is already ahead of you, producing pain or other sensations. And so imagining something is kind of like doing it, and giving someone an imaginary exposure to an activity that's triggering pain or other symptoms is giving a low-level exposure that's safe and easy to do, and which also can frequently demonstrate that the brain is actually turning on these neural circuits due to fear of the activity. So we're just kind of playing, I could just call it playing with the brain a little bit.
Well, let's take a listen on how we play with her brain a bit. So I want you to close your eyes if it feels okay.
Mm.
And I want you to just slow your breath down. And what I want you to see if you can do is just visualize you moving your arm kind of way above your head right now. And just notice, what do you feel in your body when you just picture it?
Oh, I feel like I feel pain. I don't feel it quite yet, but it makes me shiver.
Good. And so this is the predictive mechanism. Your brain, even the prediction of you bringing your arm above your head is causing this nervous system reaction. And so this is where we want to intervene. I want you to just feel your breath slowing down. And I want you to think about this scared piece of you. Think back to a time in your life where that little girl, wherever she was told that she needs to take care of other people, or she needs to keep producing, or just anything where she was in a situation where the attention wasn't on her. She wasn't getting what she needed. And I want you to imagine speaking to that girl right now. What image comes up for you? What memory comes up for you?
So I think the most prominent, because there was like just a mosaic of different memories coming up,
Yeah.
but the most prominent might be my little self, maybe just like 5 or 6 years old, when my parents were separating. I have a little sister and a big brother, and I just felt like I needed to keep them safe because it didn't feel like, especially my little sister could do that on her own. Yeah, I just never felt like I was the one being taken care of, more like the other way around. Yeah. That was just the
Perfect.
way I experienced it, I guess.
Yeah. And what I want you to imagine your adult self right now going back to that little girl and just wrapping her up in a nice hug, embracing her. And I want you to imagine just letting her know she's going to be okay, that she deserves love, and just really feel yourself just prioritizing this piece of you that feels untaken care of. And just imagine this is the first step in your path to rehabilitating this relationship and just making that piece of you feel worthy and loved. And just let her know you're going to be okay. And how does that feel to imagine?
It's very soothing
Good.
because, I mean, in retrospect, being there where I am now, I have all this hindsight to be able to say that I'm going to be okay, and it didn't feel like that back at the time. Yeah, so it feels very soothing to just give that reassurance to this scared part of, I mean, effectively myself, right?
Yeah. And so just enjoy that feeling. I want you to just experience what it feels like to have this piece of you taken care of, the safety that comes with it. And just see if you can kind of just breathe into this feeling in your body and just enjoy it for a moment. And what I want you to see if you can do is, as you're feeling this sensation of warmth and safety, just imagine you lifting your arm right now with no issues. Go back to times in yoga where you felt really strong and really flexible. And if any anxiety comes up, just imagine taking care of it, embracing it, understanding why it's there, and not tending to it because you want to fix something, but tending to it because you genuinely want to have this good relationship with this emotional piece of you. It's the most important thing in the world. And just keep on visualizing this strength coming back into your arm, this flexibility, this range of motion. And now what I want you to see if you can do is just lift your arm in practice. And how does that feel? What do you notice?
It's funny because it doesn't feel as scary anymore. I mean,
Good.
I do feel something still,
Mhm.
but it feels, just being able to connect that feeling with this very soothing emotion already makes it less threatening, I guess.
So Howard, with a clip like that, I mean, one of the things your book does is help people realize that they're actually not broken. But it also goes into teaching people how to feel relaxed and soothed and comforted. Why is that important for the brain to learn? Why is it less scary in her shoulder when she thinks of comforting herself in that way?
Yeah. I mean, the brain operates in safety or danger, and the brain needs certainty from a neuroscience point of view. When you walk down the street, you're looking at each person, friend or foe, friend or foe. When you walk down a path, is it a snake or a rope? The brain is constantly and instantly categorizing every moment as safe or dangerous. And so when we're in this situation where every time she lifts her arm, she's getting pain, she feels endangered, that becomes reinforced. And so to change those neural circuits, you have to give the brain an experience of connecting her arm and her arm movement with a feeling of safety, and neurons that fire together wire together. So when you're connecting this feeling of safety or even joy or calm or ease or freedom with her arm movement, that's a powerful way to change neural circuitry. When you do provocative testing, there may be an anxiety reaction, basically, this kind of shiver, she said. You may have the sensation, get the sensation. You may have no reaction, or you may have an emotional reaction. And what's beautiful about what you did with her is you connected your knowledge about her emotionally to her arm movement, and you did a really quick and beautiful, emotional processing intervention, and, it had dramatic and amazing results. I was in Netherlands last week, and there was a woman there who was in the class, and she had a lot of pain, a lot of diarrhea, a lot of symptoms, but they were all better with neuroplastic recovery treatments, except for pain with chocolate, pain with sugar, pain with gluten. She was still having that. And she asked me about it, and I said, well, these are neuroplastic, situations. And then she did provocative testing as part of the class I was teaching with a partner to practice. And she imagined just walking past chocolate in a supermarket, and she had discomfort, she had pain just being close to chocolate. It was that powerful reaction. And as soon as that happened, she heard a voice in her head, her mother saying, "Bad girl, you're going to feel it. You're not," she had heard her mother berating her. And instantly she connected the, the issue with the chocolate to this emotion, just connecting that. And then she said, after that, she went out, she ate chocolate, she was fine. She ate sugar, she was fine. She ate wheat, she was fine. Just the idea of connecting the emotional response to that made all the difference for her. And so even without processing it, as you did with this person so quickly and elegantly.
And just for the listener at home, I want to just kind of piece you through some of the methods we're using. And you can read all of these methods in Howard's book. But so far, we've been using some soothing, we've been using some psychoeducation. In this next clip, we're going to start kind of tapping into some empowerment sensations just to see how if that can move the needle a little bit more on the patient feeling safer around their sensations. So let's take a listen. And that's exactly what we're looking for, is if we can pair this feeling of safety with whatever that sensation is, your brain learns very quickly. And so just watch that sensation, even get really curious with whatever sensation is there and see if you can view it with a different lens now. What does it feel like? Is it a tightness? How would you describe the sensation?
It feels like it's sharp or pulling. Like it's the sharp pain that is like on the back of my shoulder.
And what I want you to see if you can do is view that sharp sensation. View it as just a muscle stretching. And just see if you can actually enjoy that sensation and feel the strength in that part of your body. And just kind of play around with it. And we're just changing your interpretation of what it is while you're in this feeling of safety. And how does that feel to view it like that?
Oh, that changes it completely, because especially everyone who's used to working out, and also yoga can be a workout.
Yeah.
For those who know, they know. And viewing it as maybe just like a sore muscle after a hard or intense workout just changes the relationship to it completely. I mean, it just doesn't qualify as threatening anymore.
And so this really appeals to your brain that likes productivity.
Yeah.
It's like, oh, I got nice and sore because I worked this out, which is great.
Yeah. Now I want to lean into it.
Yeah, lean into it. Feel like you've earned that soreness.
Yeah, it feels like I trained my shoulder. I'm really surprised right now. I mean, it completely changed. This is mind-boggling. Even the quality sort of changed right now, because it doesn't. Now I would legitimately describe it as sore and not as sharp.
And what other motions, aside from the arm raising, would be difficult for you or would be painful?
So I would say any motion that could also trigger the pain in my clavicle.
Got it.
Because even though it's not always there right now, it does come from time to time. And what was really interesting was besides the motions that could trigger it, I had a heated discussion with a loved one last week, and oh my dear Lord, my clavicle just was on fire. And it just proved to me, I mean, that was evidence to me that this is neuroplastic pain, because it was gone for days. And I had this very triggering conversation with someone very close and very dear to me. So yeah, anything still related to my clavicle, I guess, is also just still something that I would kind of avoid.
Mm-hmm.
So maybe just lifting heavy stuff, wearing my bag on my right side, on my right shoulder, and all that kind of stuff.
So I want you to open your eyes for a moment. So in this clip, I was using a lot of pain reprocessing therapy tools, graded exposure, helping her view the sensation, reinterpreting what the pain is, taking the emotion away from it.
Tracking.
Somatic tracking, exactly. Can you tell me about some of the ways that you've used PRT or some of the ways that PRT has affected your own pain journey?
I think the view of recategorizing the pain as a harmless sensation, as a false alarm, is so amazing, so powerful, because what you're doing is she's having this experience where she has an argument or a heated discussion with somebody and she gets this pain. So what is the pain there for? What's it doing? It's helping us. It's a guide. It's a message. And so we're thanking it. Thank you. Thank you for being there. Thank you for alerting me and alarming me. And that leads to this click moment where she goes, oh my God, that's evidence. She used the word evidence. And I can't tell you how many times a lot of what we're doing is we're educating people around what neuroplasticity is and how the brain works and why it does certain things. And then they go out into their life and then they see how it responds to different situations. I was talking to a woman the other day she had a sudden flare of pain. And she was like, instead of getting angry at it or upset with it or frightened by it, she stopped and took a breath and said, gee, why are you here? What's going on? So in a sense, thanking it. And she realized she had just been in a meeting. She had said yes to something when she meant to say no. She wanted to say no, but she never says no because that's how she is, how she grew up, how she's defined herself, how she finds herself, worthwhile, et cetera, et cetera. And so she decided to go back and she talked to the person. She said, no, I can't do that. And she was so afraid and sweaty to do that. But in real life, she said, I just can't do that. And then she broke through that fear and she felt pride and she felt exhilaration even. And her pain turned off on the spot. And to talk about evidence, talk about these click moments where people really feel that. And that's the beauty of PRT. And that's what you were doing with her just by noticing the sensations in a different way, giving them a different meaning. And then they shift and they change. And then it's like magic. It's amazing. It's so powerful because you're not telling somebody something. You're showing them. You're demonstrating it. Or they're demonstrating for themselves.
So in that clip, we got a little hint at the end that there is an emotional component to this pain. And sometimes in the story you've said, like, you can have a confrontation or you can kind of rectify a situation and that pain will go away. Sometimes the emotion needs to be dealt with in a different way. And we'll show you in this next piece of the clip what we mean by that. And it leads into a therapy that's near and dear to your heart, AET. There's a part of your book where you talk about realizing anger that you're having and expressing that anger and processing it is a really important component to overcoming your pain, particularly after getting fired from a job. Do you mind sharing that story? Because I thought it was one of the best parts of your book.
Oh, geez. Yeah. When you're, when you've been a doctor for 18 years at a medical school and then 20 years at a community hospital where you've been doing what you thought was good work, great work for all those years. And then one day they say, we don't need you anymore. We're not renewing your contract out of the blue. That is shocking. And, but, I said, well, these things happen, and I told people I lost my job and they said, oh yeah, I've lost my job too. I lost my job too. Everybody loses jobs. And I was like, okay, I guess it's, that's what happens, in fact, I said, it's kind of funny. Isn't it funny? I've been a doctor there all these years. I'm a quote esteemed doctor. They let me go. They fired my ass, and so I'm having all this pain and I started getting back pain. And I'm hobbling around trying to do PRT and trying to bend and move and tell myself I'm safe and everything. But I didn't connect it to emotions. I was just treating it as a false alarm. I was in my car 3 weeks later and I realized, it's not funny. It's not funny. I have feelings about it. And the main feelings were anger and hurt. So I went to the anger and I just started screaming. I was in my car screaming and yelling F-bombs all over the place, just screaming. I just allowed that anger to come up in a safe and healthy way and express it and not hold it in and be toxic to me and not do something in the real world that I would regret or send me to jail. And I went so far as to imagine blowing up the hospital with TNT, like in a cartoon. Boom. So good to just let that anger up and out. And then I could kind of settle down and I could release it and I could go to the other feeling of the hurt and the sadness. And it just reminded me of other hurts and sadnesses that had occurred in my life, throughout my life, these different events, and they're all connected together. What it feels like to be hurt, betrayed, cast aside. And one of my good buddies, Matt McClanahan, who you know, called me right around that time, and he was like so caring and compassionate. Howard, I'm so sorry. You know, we love you, blah, blah, blah. And it helped me to turn that sadness into compassion for myself. And as I was able to be compassionate toward myself, I was able to forgive the hospital because they put up with me for 20 years. And the reason they let me go was severe budget crisis. It's not their fault. And I don't make money for the hospital, but I never made any money for the hospital the whole time. So, and I was like, thanks, guys. It was a great run. Thank you for all you did for me. I was able to let it go. And the back pain just disappeared on the spot after I did that. And so this work is about really just allowing yourself to feel emotion, identify them, feel them, express them in safe and healthy ways, and move through them to compassion. And so when I first met Alan Abbas, who taught us a lot of this work, he said, this work is about compassion. I've held to that.
For the listener at home, if it feels overwhelming, the amount of tools that you can use for your pain, just to help kind of give a through line between all of this, if you think of PRT as helping you reinterpret pain sensations as safe and as not indicative of damage, this pivot we're making to with emotions is the same kind of pivot. All we're saying is we want you to reinterpret your emotions as positive, productive, not dangerous. And as Howard was doing in his car, letting F-bombs out, imagining blowing up the hospital, he was going toward his anger and he was helping his brain reinterpret it as not something that's dangerous to him, but something that's helpful and productive. And so in this next clip, you'll hear the patient go through a very similar journey to help make her interpret her anger and her discomfort with her past in a different light. And what that does is that it gives the brain an overall sense of safety that helps turn these pain signals off. So let's take a listen. So far, what we've talked about is soothing this piece of you, making it feel safe. And often that's sufficient, but there are also like this piece of evidence you just gave of your collarbone lighting up after a difficult conversation. Sometimes what can happen is when you soothe too much, there's almost this internal piece of you that feels quieted or it feels suppressed. And this piece of evidence we have of when there was a conversation that seemed to have components of anger or sadness, your collarbone let up. So we want to make sure that we're taking care of anything that might be kind of unconsciously there as well. We don't want to just be telling this internal piece of you, you're safe. We also want to hear what it has to say. Can you tell me what happened in that conversation?
That was with my dad. And it's really funny because I actually told my dad about pain reprocessing therapy and neuroplastic pain. I showed him your podcast and he could not say something sweet or positive, or he could not even say that he's happy for me. And he also, from my perspective, he has a lot of psychosomatic symptoms. Like he has this throat tightness. He's had it for 2 years straight. And he's absolutely sure that it's something physical. And I actually sent him the podcast to get him into that. But he doesn't want to see it. So so I talked with him about it. And so, and then he kept criticizing different, just very, nothing you said or someone said, just like these little tiny details that had nothing to do with what we were actually talking about. And so I told him, I said, it's actually making me really sad that you can't just be kind and say something nice, and that you focus on these little unimportant details instead of telling me that you're happy for me, that this huge thing that has impacted my life for the past year, that I might have found a solution to it. And so he reacted very harshly to that. I was lying on my acupressure mat, crying, and just with this throbbing collarbone. Like it was just, I was cry laughing actually, because it was almost a relief also, because up until that point, I was still convinced that it might also be something somatic. And that for me was just proof.
Yeah.
that was just evidence.
I supervise a bunch of therapists, and whenever we hire a new one, inevitably they try to tell their parents about what they're doing or help their parents. And the line I'll give you, which is I give to them, is if you were to have helped your dad there, you would have become the first clinician to ever have helped their parents' psychosomatic sensations. I've never seen it work before.
Wow. Yeah.
And it can be absolutely maddening. And so first, I want to normalize what you went through. And then second, I want to help you process this sensation, because what happened is something that really scared your brain. It's why that collarbone pain came on. And it's often some sort of emotion that came up that your brain just doesn't really want to deal with, and it freaks it out.
Yeah.
Does that feel resonant to you?
Absolutely. I have, and I am so certain of it, I have so much unresolved anger towards my dad. Anger and for sure also different other emotions, but I have never identified myself as an angry person, because I was not allowed to be that. I was supposed to be quiet and functioning, and angry is just the difference, like the other end of the spectrum, I guess.
This is why it's so important for us to do some emotional work, because quiet and functioning is kind of like soothing, where it's like when you're telling yourself you're safe, you're kind of telling your internal self, like, be quiet, just relax. Shush. Yeah, exactly. And we just want to make sure that this piece of you feels heard and understood and able to express before we fully go into the soothing. And this is where a lot of people kind of hit a wall, because the soothing can kind of get them so far, but then there's this piece of you that says, like, no, I have something to say. I don't want to just be told to be quiet so you can go back to yoga. If that makes sense.
Yeah, it resonates 100%.
And the second piece of this is this angry piece of your brain, this emotion. It's a huge component of confidence and assertiveness, to feel like you are sturdy and feel like you can support yourself and fight off any kind of danger you have. And so not only is this piece of you we want it to feel able to express, but we also want to light this part of your brain back up that contributes to you feeling confidence and contributes to you feeling assertive and sturdy. Does that make sense?
Absolutely. I think that as you say it, my brain was like, but I am confident. I do this and I do that and I can do this. And because I've always only been confident in what I knew and what I knew how to do, like in knowing stuff and in proving others that I know stuff, and not by my own person, but by showing others, like, I know I can do this and I have done this and I know that.
Wow.
And I have never been like, I have never felt confident on my own, but more by what I did or what I
100%.
represented.
We'll get to the treatment component of this in just a few minutes, but one of the things that she brings up there and that I have really appreciated about your work is figuring out how these emotions tie into the needs of the brain. And I know that idea of assertiveness or agency came up there. Can you tell people about some of these needs our brain has that can be stymied when our emotions aren't present and we're not using our emotions?
Yeah. Mark Lumley and Mark is a brilliant, by the way, psychologist at Wayne State. He's written 300 papers now. He's seen everything, done everything. He's been my partner with this for a long, long time. And one of the things that I think I give him a lot of credit for is this formulation of agency, connection, and self-integrity. And agency is when a 2-year-old stands up and says, no, they have agency. They can affect their life. And so many people have been brought up in conditions where they had no agency, where they weren't seen, heard, listened to, where they couldn't make up their own mind, where they couldn't have their own opinions, where they couldn't express their feelings. And when that agency is there, your brain is not going to be happy. You're not going to feel safe, because you're going to get trampled on time and time again. So lack of agency, huge thing. But the other need, in addition to having agency and standing up for ourselves and asserting ourselves and having the ability to make up our own mind, is connection to others, because we're social beings. So the other side of that is connection and being able to be vulnerable and trusting people. And again, so many people have been brought up in situations where they weren't really cared for, they were betrayed, and so that connection was lost. So they're afraid, or it's difficult for their brain to get close to people or be willing to be close to people, because they're likely to be hurt. And so that need to be connected to others is critical. And then the third one is self-integrity, self-care, pride in oneself, compassion for, and oftentimes that's missing because of the situations where people grew up in. And sometimes that's the most important thing in order to have agency. If you don't really care about yourself, if you don't think you count or you matter, how would it ever occur to you to be able to stand up and assert your needs or speak your desires or needs? And if you don't really care for yourself, you don't feel worthy and loved or lovable even, how would you be able to be really truly connected with others and trusting and vulnerable? So when you take those three parts to it, that's how we conceptualize people's needs and how we try to think about those as we do EAET.
And when those needs aren't met, why does that lead to more anxiety, more pain? Can you kind of connect those things?
Yeah, because those needs are so basic to make you feel safe, to make you feel worthy and loved and important. And, kids who grow up not having those needs met often never feel safe. And it's only a matter of time for when neuroplastic symptoms are going to start as more things happen in their lives.
I see this all the time with patients like Luca, where they're in medical school, they feel like their agency is coming from them being productive and achieving. And then all of a sudden things slow down, or maybe somebody loses a job, or maybe their career doesn't progress as fast as possible, or their relationship falters. And all of a sudden that sense of agency decreases. They don't have anything to kind of pin their worth on. So what I want to show folks in the next clip is just how you use some of these emotional expression tools to help your brain light back up that agency and start getting this feeling of safety coming back, even when you aren't accomplishing anything in the moment.
Can't wait.
I want you to think back to that conversation with your father. And what happens with you, you can see the sadness comes easy to you. Even like this beautiful sense of humor you have comes easy to you. But we want you to actually process this situation with some anger as well. I want you to see if you can notice if you feel any anger in your body right now. How do you know that that situation made you frustrated?
I feel it. I feel it in my chest. Like it's funny because the first thing when you just said like how did that situation feel, it was first sadness. And only when you said anger, I sort of felt the anger.
Good. And to feel that anger, I want you to actually ask it to build in your body right now. And you might notice some sadness come on. You might notice some shame or some guilt that tries to get in the way of it just because your brain's not used to going here. And what I want you to see if you can do is almost courageously go toward this anger. And if it was just the anger speaking, this is not you, this is not your full self, it's just your angry self speaking, what would it have said in that conversation?
It would have said, I am allowed to feel and I am allowed to say what I feel, and I am not to always be quiet and repressed.
And just see if you can keep it going. What else did you want to address with him? What else does your anger want to say? What did that little girl want to say that she was unable to say back then?
How many things in my life are the way they are because I learned them to be the way they are, and not because I wanted them to be that way, or I felt like they should be that way, but because they were sort of imposed on me. A lot of feelings, a lot of thoughts, a lot of automatisms, just that feel natural to me today, were never my idea in the first place.
And how does that make you feel, the fact that this was kind of forced upon you?
It feels so unjust. It just
Good.
feels unjust and boundary breaking and also a bit violent.
Tell me about that.
I mean, it just feels like external emotions were projected onto me as a child that had nothing to do with me and had no place being in my vicinity.
Good. And I want you to imagine your adult self protecting that little girl, forcefully removing any influence on her. Use violence. Imagine protecting her aggressively and feel that anger build and feel like it's a good thing. This allows you to protect that piece of you. And how does that feel?
It's funny because I keep picturing like a miniature Godzilla protecting my little self with this huge shield. It's funny. And that feels very reassuring, and just it's sort of this, because this little Godzilla is allowed to be angry.
Amazing.
And because that's his nature. Yeah. That feels, I don't know, just very right.
And I want you to use this image. Imagine this little Godzilla angrily shielding and feel that in your arm. Feel that Godzilla arm, that little Godzilla arm raising
Oh
up. And I
yeah,
want
this
you to
is my
feel it.
Godzilla shield arm.
Feel that shield raising up. And what do you feel as you raise that? You raise that with assertiveness and anger and say, I'm not going to take this idea that I'm broken. I'm not okay with that. How does that feel?
It feels much more powerful. It actually feels like protecting that part of me and carrying this huge Godzilla shield is way more important than the pain. Yeah.
And just play around with that. Imagine yourself having this incredible strength to lift that shield and using that assertiveness. You're going to need this to lift that weight.
Yeah, that makes a whole difference.
And this is what I want you to get used to, is when you move this arm, when you feel that sensation, getting into this mindset of not just safety, but also assertiveness. I'm not going to accept that I'm broken. I'm not going to accept that this is, like what you said before, these external influences being kind of forced on you. And just feel that strength come back. So many people experience not just pain, but also almost like a fragility or a weakness. And I want you to just feel that. Do you resonate with that?
Absolutely. Yeah, no, my whole right side was actually my writing side, my dominant side. It's just, it feels so weak and so powerless, not only in strength, but also in capability.
And just feel that, almost lean into the anger as you move your arm. And what's the quality of the sensation feel like now?
It's different. I feel like I can move my arm way higher up than before, which is already just feels like wow. I don't quite know how to describe that. It's a bit like before. It just feels less threatening. It feels like it's lost some importance.
Yeah. And here's the last thing I want you to do is you'll notice that you can do some bracing around that area to protect it unconsciously. You'll notice in your back or in your hip or in your arm, you're kind of just being careful. What I want you to really think of right now is I do not have to be careful. Almost get aggressive with it, of like, I don't have to protect this anymore. And any sensation I feel, even when I'm being unprotective, is totally safe. And just get a couple reps in there, really loosening your body up and just being like, I don't have to be careful anymore. And if you need to use some of that assertiveness, that anger to convince yourself, I'm sick of being careful. I'm sick of being protective. And how does that feel when you kind of take that mindset?
It just feels like I don't have to wait for the pain. The pain has to wait or get lost.
Yes, that's you being on the front foot. That is perfect.
It feels like I'm gonna carry my bag from now on my right shoulder as I'm used to doing
Good, that's
it.
what I want. How can you make that connection of when she allows herself to feel anger, she feels this strength come back in her, she feels like a difference, she actually wants to use that arm? Why does that happen in the brain?
Yeah. I mean, it's amazing how oftentimes the sensations or symptoms that our brain produces are meaningful. They're a message, they're a guide, they're symbolic of something. And sometimes it's not easy to see that, or it's kind of covered up, but you have an amazing way of bringing that out. And our brains are trying to protect us, obviously, and trying to help us. And I mean, Freud had a patient, 100 years ago or whatever, where, the guy was berated, by his father, abused by his father, and his right arm was dead. Why was his right arm dead? What was his urge? His urge was to hit his father, but hitting his father would create guilt, so much guilt that his arm went dead. And so the symptom needed to be reversed. And that's exactly what you did with her. Exactly what you did with her. Use the imagery of the shield and her arm and holding it up, and then you tied it right back to her arm. And so, you're like breaking down this distinction between PRT and EAET. You're like melding them into one. And we've talked about that in some of our discussions with Yoni, for example, Yoni Ashar, saying, well, should we call this PRT? Maybe we should call it integrated PRT. Maybe we should call it pain and emotion reprocessing therapy, PERT, and because in the puppy trial that, you were involved in, a lot of work was done, not with really traditional, very narrowly focused PRT, which is helping people feel safe cognitively, but really bringing in emotions to it as well. And Mark and I are doing a large EAET trial now, and we've incorporated some aspects of PRT as well. So, the idea of using these together and integrating them is just so much more meaningful and powerful. Really seeing that pain and fear and emotions and the whole range of emotions that people can feel. And, we didn't have time to get into all of them, but you think about not just the anger, but the guilt that may come up, the sadness, compassion, as I talked about in my little story as well. So powerful to really, as you pointed out, help the brain feel that no emotions are bad. All emotions are good. They're all there to help us, to guide us, to protect us. And we can learn from them and use them to become better versions of ourselves. And you can see that happening with her right in front of you, in front of your eyes, her changing her relationship with her father, not seeing him as all knowing and all dominant. And he's exposed as nitpicky and petty and criticizing for no reason. And she's like, I'm grown now. I'm not taking that anymore.
Criticizing the podcast. How dare he do
My
that?
God.
And if you're listening at home and it feels, I usually get two reactions to kind of melding this work together. Is one, I have a hard time feeling my emotions. And we're going to talk on future podcasts on how to help that process and how to break through that. And on the other side, people say, well, when I go to my emotions, they're so explosive, I can't pull myself out of that. And I want people to keep on listening because in future shows, we will talk about how to kind of overcome some of these barriers, especially as I work in this new trial at Mount Sinai. We're working with people, even in the puppy trial, with a tremendous amount of trauma, learning how to utilize these tools in a way that's trauma effective and not being afraid of the idea that people have trauma in their past. And Howard, we're almost at time now, and I just wanted to give you an opportunity. If there's anybody out there listening who's struggling, or even some of the things they've heard today, feels frustrated, or they feel like they just can't get over that hump, do you have any message for anybody at home who's really trying and hasn't found their solution yet?
Yeah. The brain is endlessly neuroplastic, and everything that's happening right now is happening right now. And so there's always hope for changing things by incorporating the techniques that, you're using and that we're writing about and that we're talking about, and not being afraid to do something completely different, not being afraid to really move toward what's important to you. And oftentimes the thing that makes the biggest difference is people moving towards something in their life that they really care about, and not doing things to get better and fight the symptoms, but to do something to make themselves fulfilled and purposeful and happy and joyful. And I've seen people cured by motorcycles, for example, something that's really compelling and fun, and people healed by guitar. And so the brain is endlessly neuroplastic. And no matter how much trauma there's been, no matter how much pain there's been, what's happening right now is happening right now. And it's based on moment by moment predictions by the brain. And those predictions can change. And so I think that's the message that I'd like to leave with people.
Thank you so much for being here today. Howard's new book, Unlearn Your Pain, comes out May 26th. Is that the date? You can go on now and pre-order. I promise you will be happy with your purchase.
You're so kind, John. You do a great job with this. I'm so glad to be in this community with you, and I look forward to seeing you again soon and playing golf with you again.
Fantastic. Can't wait. Thank you so much for listening to The Solution Behind the Symptoms. I'm going to give a huge thank you to Luca for sharing a piece of her journey. If you want to learn more about Howard Schubiner, you can visit his website at unlearnyourpain.com or on Instagram at hschubiner. And if you'd like to be a patient on a future show, message me on Instagram at johng.therapy, where I answer questions and share tools from my practice. Thanks again.